If people fail to lose weight after diet and exercise, treatment with medications can be the next step. All the 5 medications discussed here are FDA approved. They are not recommended for pregnant women and nursing mothers. They should be taken only as an adjunct to dieting and exercise. People who meet the following criteria are candidates for the medication treatment: people with a BMI 30 or above, or people with a BMI 27 or above with comorbidities such as hypertension, high cholesterol, type 2 diabetes, or obstructive sleep apnea. People should continue to commit to a reduced calorie diet and increased physical activity. One of the medications is called Orlistat. There are 2 formulations on the market. Alli is an over-the-counter medication, and Xenical needs to be prescribed by a physician. Orlistat is a lipase inhibitor. Lipases are enzymes in the lumen of stomach and small intestine. These enzymes help digest the non-absorbable triglycerides in food into absorbable fatty acids and monoglycerides. The medication can reduce 30% of fat absorption from each meal. Remember, each gram of fat contributes to 9 kilocalories. Orlistat can be taken during or up to 1 hour after each fat-containing meal. You should skip the dose if a meal is missed or if the meal contains no fat. Since Orlistat reduces fat absorption, it can cause a deficiency of fat-soluble vitamins. Multiple vitamins containing fat-soluble vitamins such as A, D, E, K, and beta-carotene should be taken at least 2 hours before or after Orlistat is taken. Orlistat can be given to children 12 years or older. People with cholestasis and malabsorption syndrome should not take this medication. The side effects are flutters with bowel movements, fecal urgency, fecal incontinence, gallstones, etc. Very rarely, it can cause severe liver damage. Xenical is a prescription medication. Each capsule contains 120 mg Orlistat. Xenical costs about $700 per month. Alli is an over-the-counter medication. Each capsule contains 60 mg Orlistat, and it costs about $50 per month. Phentermine is an appetite suppressant. It is indicated for people over 16 years old. The medication is recommended to be taken before breakfast or 1 to 2 hours after breakfast. People with cardiovascular disease, uncontrolled high blood pressure, agitation, hyperthyroidism, substance or alcohol abuse should not take this medication. The side effects of the medication include agitation, insomnia, dizziness, heart palpitation, increased blood pressure, dry mouth, pulmonary hypertension, etc. Phentermine is a controlled substance and can be addictive. It can only be taken for about 3 months to minimize adverse effects and potential addiction. Phentermine at the dose of 37.5 mg a day costs about $12 to $16 a month. Qsymia is another weight loss medication. It helps suppress appetite and enhance satiety. This medication has 2 active components, topiramate and phentermine. The medication is indicated for adults only. People with glaucoma or hyperthyroidism should not take this medication. Qsymia should be taken once a day in the morning. The dosage of the medication can be gradually increased every 2 weeks. People with kidney or liver impairment should take a lower dose. The medication should be discontinued if a minimum of 5% of weight loss has not been achieved in 12 weeks. The medication should not be stopped abruptly to avoid seizure. The side effects of the medication include numbness, dizziness, distortion of taste sensation, glaucoma, cognitive impairment, kidney stones, etc. Qsymia costs over $200 a month, although its components, the pyramid and Phentermine, each cost about $10 per month. Contrave also has two active components, bupropion and naltrexone. How exactly this medication works to help weight loss is not fully understood, but both medications affect areas of the brain that regulate food intake. The medication is indicated for adults only. People with uncontrolled high blood pressure, seizure disorders, bulimia, anorexia, or current opioid medication use should not take this medication. This medication is started at 1 pill in the morning and can be titrated up by 1 tablet per week until the maximum dose of 2 tablets twice a day is reached. People with impaired kidney or liver function should take a lower dose. This medication should be discontinued if a 5% of weight loss has not been achieved after taking the maximum dose for 12 weeks. The side effects of the medication include nausea, constipation, headache, vomiting, insomnia, etc. Contrave, at a full dose of 2 tablets twice a day, costs over $800 a month. Its components, bupropion, at 300 mg a day, costs $14 to $20 a month, and naltrexone, less than $30 a month. The last medication is called Saxenda. It is an injectable medication for weight loss. It causes weight loss by appetite suppression. The medication is indicated for people 12 years or older. People with either a family history or personal history of medullary carcinoma of the thyroid, or people with a hereditary syndrome called MAN2 should not use this medication. This medication is injected subcutaneously, starting at 0.6 mg a day, and the dose can be increased by 0.6 mg per week until reaching the maximum dose of 3 mg per day. The medication should be discontinued if 4% of weight loss has not been achieved after using the maximum dose for 16 weeks. Common side effects of the medication include nausea, low blood sugar, diarrhea, constipation, vomiting, fatigue, dizziness, etc. The monthly cost of Saxenda is about $1,400. In summary, there are a few FDA-approved medications for weight loss. All of these medications are not recommended during pregnancy or breastfeeding. Please have a full discussion with your physician on the detailed contraindications, drug interactions, and side effects of each medication you are going to take. Always keep in mind that healthy dieting with regular exercise plays a critical role in weight loss. If you still have trouble shaking off the extra weight, even with medication treatment, you may consider to try a device, a medical procedure, or surgery for weight loss, which I will discuss in my next video. Thank you for watching.